Okay, here we go. I see people. Make sure. Okay, awesome. All right, we're going to give everyone a minute to join our webinar. We do have Spanish interpretation available. So if that is needed, there should be on the bottom of your screen an interpretation button.
No yet. I don't think you set me up yet.
Oh, Maria,
Do you want me to do the instructions really quick before you do that?
sure.
Vamos a tener servicios de interpretación simultánea. En unos momentos aparecerá el icono del globo terráqueo para que seleccionen Spanish, que es español, para escuchar al intérprete. Pueden poner en silencio al orador principal si solo quieren escuchar al intérprete. Gracias. So it will be under interpretation, and I think my name is under interpretation, but,
Okay.
and then from English to Spanish.
Oh, where'd Maria go? Hang on, because they know.
I'm still here. I'm trying to look for our interpretation button. Once we moved into um, webinar, the button on the bottom of the screen is now gone.
Oh no. Let's see. All right, everyone, thanks for joining. We will get started in 1 minute.
Gracias a todos por acompañarnos. Vamos a empezar en un minuto.
Oh, Maria, do you see under the More button, there should be an interpretation. Now I see the interpretation button on my side.
I'm unfortunately not seeing it. I'm sorry, but I think Megan, if you're able to manage it, I'd really appreciate it.
Okay, so it says,
I see transcript. I see show captions.
you don't have like under the More button, it says.
I
Just
clicked
like this.
more and it has record, whiteboard, apps, and reset to default. Yeah, so funny.
Okay,
Sorry
no
about
worries.
that.
No, that's fine. Interpretation. Hang on. Add interpreter. Search by name. Oh, okay. Okay. So I just sent, so I can add the interpretation. Oh, it just says, okay. Oh, here we go. Okay, sorry, y'all. We will get started in just 1 minute.
Unas disculpas, vamos a empezar en solo un minuto.
Language interpretation available. Okay. Okay, great. So it looks like interpretation is ready. Awesome. Okay, well, we will get started, everyone. Thank you all for joining us today for our DPS prevention webinar. I am going to introduce our two presenters today. And if you have any questions, you can drop them in the Q&A feature. The chat function won't be available during the webinar, but you can put questions in the Q&A, and then at the end of the presentation, we will have time for questions. So I will go ahead and get started. My name is Megan Michio. I am on the substance use float team here in DPS. I'm also a senior team lead in the district. And so as one of my roles, I help with supporting our monthly webinars. And at the end, we'll have a quick feedback form, and then we'll share with you our next topic for our webinar. So to get started, we have today with us Jenny Wood. Jenny is a senior implementation specialist at Synergy Enterprises, Inc., with more than 27 years of leadership in state and local government. She's a national leader in implementation science, coalition building, and evidence-based prevention. Prior to coming to Synergy Enterprises, Jenny had directed Colorado's Behavioral Health Administration's Criminal Justice Behavioral Health and Community Prevention portfolio, represented the state in the National Prevention Network, and led the Community Prevention and Early Intervention System in the Behavioral Health Administration, and also served as Assistant County Manager for Summit County, Colorado. And then we also have Chelsea Heffernan here with us. Chelsea has over 10 years of professional experience in project management, technical assistance, adult learning, and coordination. In her more current role as project specialist for the SAMHSA Talk They Hear You contract, Chelsea has been able to use her skill set to coordinate all aspects of the project, develop relationships with current and new partners, manage a case study of the Talk They Hear You campaign, develop online trainings, print and digital products, manage the dissemination of the campaign podcast, and lead the development of a new prevention screening tool. Through her work with educators in the Talk They Hear You campaign, her work has been focused on families and students who have circumstances that put them at risk, including mental health, food insecurity, violence, drugs, and alcohol addiction. Using instructional design best practices, Chelsea has been able to provide technical assistance and develop tools and resources that can support them. So thank you both so much for being here, and we will turn it over to you. Thank you.
Thank you. I am Jenny Wood, and Chelsea and I are going to take you on what I really hope you think is a fun adventure. We're going to walk through the nuts and bolts of the Talk They Hear You campaign, which is a free national media campaign, but it's not just a public service announcement campaign. As you'll learn, there's different tools and techniques that you can access and customize, all free, no cost to you. And I know the financial part is a huge incentive for a lot of folks because budgets are especially extra tight right now in our state. I am in Colorado still, so I'm well aware of the situation that's happening within our state. And Chelsea's going to start us off, and we'll take it from there.
Thanks, Jenny, and thank you, Megan, for the intro. Hi, everybody. It's good. I'm really happy and excited to be with you all today. So here's our agenda. So first, as school-based prevention leaders and school professionals, you all understand probably the best the cost of inaction. Any missed opportunity that we have with youth, be that in their education or specifically with their substance use, it can show up later in school strains, health disparities, unmet needs, then the list can go on and on. And that's why we're here to talk to you today. We're going to talk about how to use the campaign, an overview of all the free tools that Jenny described a bit, and then we'll just really talk about how this campaign supports your role in driving those upstream solutions for students. So here's why the campaign is tailor-made for you and for all states. So these are ready-to-go tools. They're fully developed, tested, and they are free. They align with prevention metrics such as risk reduction, early identification, and engagement. They support coalition building and they elevate school districts' visibility on prevention. And you can deploy them wherever prevention happens within your school. So be that through assemblies, if it's a school resource officer, counselors, teachers, any parent groups, provider networks, and even social media. So we span all of the those places. Okay. These next few slides, I'm going to talk a bit about some data and statistics, which I'm sure you all know that there is an urgency and prevention is necessary. We all know that there is a problem with alcohol use in the country, but sometimes seeing these statistics and data again just really makes it a little more prevalent and talks to why we are here to talk about the campaign with you. So the U.S. Surgeon General issued this advisory in 2025 saying that alcohol is now a top preventable cause of cancer in the United States, driving 100,000 cases and 20,000 deaths annually. So this is pretty shocking, and it signals that there's a clear opportunity for states to leverage the prevention messaging that addresses both the immediate or short-term and long-term health risks. So alcohol does remain the leading cause of preventable death and illness, now including cancer. These statistics remind us why that early strategic prevention is critical and why those effective tools are essential for supporting youth and their families. Now, here's an image that shows you the 7 types of cancer that consuming alcohol increases. So again, just another slide that reinforces the urgency of prevention. Okay, here's some more information. So between 2020 and 2021, over 178,000 Americans died from alcohol-related causes. That's more than opioid deaths in the same period. And on the right side, this data is from the Drug Abuse Warning Network, or DAWN. They are a public health surveillance system that monitors emerging trends and characteristics of substance use related emergency department visits. And they did a study from January 2021 to September 2023, and there were 8,566,725 emergency department visits related to alcohol. 8.5 million. Alcohol was the most prevalent substance involved in the visits, with twice the number of visits compared to opioids or cannabis. Ages 26 to 44 had the highest rate, with about 1,500 alcohol-related visits per 100,000 people. The most common diagnoses were related to intoxication and binge drinking. And among the alcohol-related visits, 80% were alcohol only, 20% involved a second substance, which was mostly cannabis. Again, shocking numbers. This data shows substance use disorders by age group. We can see that adolescents and young adults are at significantly higher risk, and early use often leads to those long-term issues. This is where, again, prevention is most powerful. We'll talk about why our campaign is so important, because it focuses on reaching parents, schools, and youth-serving professionals, so those who are in youth's lives the most, and reaching them early and effectively. Okay, 2 more data slides, I promise, then we'll get into the good stuff. So this is from the National Survey on Data Use and Health, NISDA for short. So we can see here that people aged 12 or older, alcohol remains the most commonly used substance, with over 134 million people reporting past month use. And here you'll see underage drinking use, binge alcohol use, or heavy alcohol use in the past month from people aged 12 to 20. And while we see that alcohol has decreased, binge and heavy alcohol use still had no change. And the the underage alcohol use didn't decrease by too much, but still prevention, works, and we need that. It's just reinforcement that we need to keep doing what we're doing. Okay, now let's get into the campaign. So, Talk They Hear You. At its core, this campaign is about empowering adults. Again, like I said, the adults that are in a youth life, so parents and caregivers, schools and educators, or members of the community. It's to help them get informed, so be aware of what is going on with substance and alcohol use in not only the country, but locally, in their community, in their state. So that's the get informed. It's also for them to be prepared. So to have the tools to feel that they can talk to youth and feel confident in what they're saying and why it's important for prevention. And then finally, to take action. So the goal is for these adults to have and start conversations early and continue the conversations often about alcohol and other substance use with youth. The Talk They Hear You campaign, it's a public health strategy that's packaged as a user-friendly media campaign. And it's built to be deployed at scale in states, in counties, schools, coalitions, districts. You don't need to build something new. This is a one-stop shop, and the hope is that we've done the heavy lifting for you already. So let's go into some of our products. So we have brochures. We have TV PSAs, radio PSAs, and print PSAs. Our TV and radio PSAs span from 15 seconds, 30 seconds to 60 seconds. We have fact sheets, and we also have Spanish language products. Here's some of what our print PSAs are. And the cool thing about our PSAs and working with the Talk They Hear You team is that you can customize and adapt the products to fit your branding, to fit your messaging. If you don't like any of the images and you want to tailor them more to your community and what your community looks like, we can support you in that for free and help you adjust them as needed. Two things that aren't pictured here that I did want to touch on were the discussion starter guides and discussion starter videos. These are really great products, kind of as a getting started point if you're having a PTA meeting, if you're working with youth serving organizations, or you're just doing some trainings, but they're videos that are about 8 to 10 minutes long, and they touch on each of our audiences, which is the parents and caregivers, schools and educators, and the community members. And it depicts how you can turn simple everyday moments into prevention opportunities. We have facilitator guides that go along with them. And, it tells you where you can pause the video, have some conversation, and really get that conversation going within the group that you're with, so that messaging starts kind of coming out and is at top of mind. So that is our discussion starter videos. Oh, and the other thing that's not pictured is our social media. So as I said, we do provide some social media. We know that social media is a very powerful tool. Everyone is using it and to get their messages out. And we know that hiring somebody to do something like that, or sitting down and taking the time to write powerful marketing messages, is tough. And being in a school, I'm sure you have a ton of time to be able to do that. Just kidding. But we have created some pre-written posts. We have graphics. We have our campaign hashtag, and you can take those as is, pop them in, schedule them out, and make it kind of that messaging consistent across all your social media platforms. Okay. I have 2 more slides, and then I'm going to pass it over to Jenny. We have our Talk They Hear You mobile app. So this app is really directed towards parents, caregivers, guardians. But really anybody who is wanting to or thinking about having that conversation with a youth, this can be helpful. So what it provides is different scenarios and practice opportunities for you to be able to put yourself in that situation where you might want to spark that conversation and start it. There's a feature on there where you can record yourself and you can listen to yourself back. So, because these talks can be a little bit intimidating, and you don't know how the child or the student will react. So you can record yourself. They give there's some prompts in there that you can use to start the conversation, but it's free. It's in the App Store and the Google Play Store, and it just gives some practical advice. And then we have Parents Night Out. So this is it can span from 1 to 3 hours of a flexible training format. So this is really if you're wanting to, I guess you can say, train parents or provide parents with information, and you're wanting it to be related to substance use prevention. It builds that awareness. It offers different tools, and it gets the people talking. It gets parents talking about it. It gets them thinking about it. If you're looking to stretch your prevention dollars, build capacity, expand your reach, these tools offer that real scalable solution, and it's free. So those are some of the ones I just spoke about. Write down your questions. I know that was a lot, or to put them into the Q&A, and I'm going to pass it to Jenny to talk about some other pieces from the Talk They Hear You campaign.
Thank you, Chelsea. So what I'm going to talk about really falls into the latter part where parents are learning how to take action. So Chelsea kind of walked us through the awareness piece and building that. Now, what next? So first up is our What Parents Are Saying podcast series, which is phenomenal. If you're like me and short on time, podcasts are such a nice way for busy people because humans are just busier than ever. And it really brings the prevention piece into the real world, and it's parents sharing honest stories about what worked for them and what didn't work and how they're navigating through those conversations with children in their lives. It's available anywhere. I sound like an infomercial. It's available anywhere you can download your podcasts, and schools can feature these episodes in newsletters, training events, or as a companion content in a parent outreach. So if you have a parent that you're working with their student and you know that they're struggling with a certain area, they're all titled, and it gives you an idea of what might be most beneficial to them. And it's really one of the most engaging, relatable resources in the Talk They Hear You campaign suite of products. And it's built specifically to support parents, caregivers, and professionals who work with them. And again, it's real conversations navigating difficult topics from underage drinking, vaping, peer pressure, mental health, and setting boundaries. Episodes, some of them highlight parenting styles and family experiences because there's no one size fits all approach, as we know. Guests range from everyday parents to experts in the field and maybe a celebrity in there. And why it matters is because it really models that healthy communication is a perfect way. I need a drink. Colorado, so dry here. It attacks my vocal cords. So it's a healthy way that having that communication really reduces the stigma and opens up the door to having those ongoing conversations rather than a one-time talk, which, it used to be in the olden days when some of us were children, it was just don't do drugs, don't drink alcohol, and that was it. So, and it also helps parents feel comfortable and confident. I know when I've listened to them, it's helped me know how to frame things when talking about underage drinking and substance use in my own personal life with my family. And what's even more exciting is we have a new series that's coming online like any day now. And I'll talk a little more about this in the next slide, but just to give you a teaser, so we took motivational interviewing and built it out to have it be relayed to parents in a conversational manner through the podcast. So the episodes are walking listeners through practical communication strategies that are grounded in the MI, motivational interviewing, and positive youth development. And the topics on this part of the series, which is going to be called Communicate and Motivate it's the mini series of the larger What Parents Are Saying podcast. But some of the topics are going to be, how to listen without judgment, expressing expectations clearly, and responding when a teen shuts down, which we know happens with teens. And the goal really is to give parents actionable, bite-sized techniques to build trust and help keep the door open for future conversations. And it features the host that's in the series, and then 2 prevention experts with extensive experience in the field. And it is just phenomenal. And I think you'll find it really useful when that's released. So that's coming soon to a podcast platform near you. And how this can benefit you, again, it's something that you can feature in your newsletters, PTA events, school trainings, whatever it is that you do to disseminate information. This could be part of it. And again, it's something that could be shared on your social media, the links and clips. It's going to be available also via YouTube. So there's a video version of this. So it's available and accessible in all different platforms. And it really makes prevention and motivational interviewing feel like it's within people's reach and easier to do. And it helps give those techniques. So I think you'll love it. Next slide, Chelsea. So we put our tools into 2 different buckets. The first being for parents and caregivers. And again, this is the next evolution of the campaign, involving tips, tricks, tools, and techniques for parents to learn skills and create awareness, and use those techniques to communicate and motivate their child or any child in their life. It doesn't have to be a parent-child relationship, any concerned adult. And this, again, like I mentioned, part of it is in the final stages of development, and it will be released soon. And it was born out of direct response that we received, what parents and community partners want and needed to help build trust and connection with children in their lives. So it's pretty exciting. And the parent and caregiver technique, tools, and tips sort of bucket falls into 3 critical elements. The first one is awareness, giving parents a better understanding of the challenges that young people are facing today, and peer pressure to mental health, to substance abuse availability. And it comes in the form of educational material that Chelsea talked about, and then also some of the tools that I'm going to talk about. And we know that youth are facing more than ever in their lives. I mean, it is so tough, the challenges and everything that youth have to deal with now in today's time. So I think this can be really crucial and a critical tool for parents and caregivers. The next piece is rapport. And as we know, helping caregivers, parents, concerned adults build strong, safe, and open relationships with children, because kids are more likely to talk and listen when the foundation is in place. And that's so crucial. And some of the new podcast series will touch on rapport building and offer techniques to help adults, concerned adults, and parents, caregivers learn how to do that, because it's about building that confidence and knowing how to take action. The next piece is communication, and really equipping adults with strategies to initiate and maintain those meaningful conversations, especially when the topics are uncomfortable and hard, or the timing feels off. The podcast is really going to help provide tips and tricks on how to walk through that. So all of these techniques are built on the science of protective factors, which I'm sure you all know about risk and protective factors. And we really want to build up those protective factors, and strong parent-child bonds are consistently one of the most powerful buffers against early substance use and other risky behaviors. So this is prevention at its most relatable. It helps adults move beyond the don't do drugs, or the old, I don't know if anyone remembers frying the egg and saying that's your brain on drugs. It really brings it into real connected conversations that motivate, guide, and support you through every stage. And the podcast piece of these tools are coming fall of this year, so any day now, and we can push that out to you all when it is ready to be shared with the public. So next slide. Oh, you're there. You're quick, Chelsea. So the next bucket of tools is for youth serving professionals. And this slide really talks about the key expansion that the campaign went through. And it introduces a suite of early intervention tools and techniques for youth serving professionals or any adult, again, that is concerned about an adolescent child in their life, and they want tools to help them increase those protective factors and reduce risk factors. The resources help bridge that gap between prevention and formal treatment, where I think a lot of your services probably fall as well. And it really equips adults who interact with youth daily to respond with the care, the skill, and the confidence. And the approach is similar to the way like annual health screens are conducted. We have a free screening tool, which I'll talk about, I think, in the next slide, but I'll give you a little teaser. Now, it's a free screening tool that's available on demand. It's online. It's called Screen for Success. Screen for Success. And again, it's free. I know I said that, but I think that's really important to emphasize. And it will help you flag if there's any concerns for elevated risk around health and wellness, and if you need to move on to like some early intervention services. And the hope is that screening catches any concerns early before it progresses. And again, it's no different from getting your blood pressure taken. And we'll just walk through the different steps of the package for the youth serving professionals. So again, the first step is screening and early identification, which is done through the entry point is Screen for Success. And again, it's a multidimensional screener. It's been tested on youth age 12 and up. So that's what we recommend, that it's used on age 12 and up. And it's ideals for, I think it would be ideal for your prevention services unit. And if you want to, tell other folks about it, that's fine. There'll be a QR code later in the slides on how you can sign up and access it. And it really empowers non-clinical professionals to spot early signs and open supportive conversations. And again, it's available now. There's 2 types of accounts, which I'll get into a little later. And the other neat piece too, when you're working with parents, if they are concerned about their child that you might be seeing in the schools or another child in their home, they too can sign up and have access to the screening tool. And it's anonymous. You do need an email and all of that to sign up, but all of the data and whatnot is anonymous. So then the first line of support is motivational interviewing and motivational enhancement. So after the screening, the next step is how to engage youth. And the online training modules, which Chelsea is one of the brainchilds behind the development of this training. So there's an online module, which is fantastic. You can do it whenever you have time. You get a certificate at the end if you need that for your continuing education units. And it helps just learn those techniques about, and it's also a refresher. If you've been through MI too, it's nice to have that refresher on the importance of asking open-ended questions, affirming their strengths, and doing the reflect back what the youth are telling you that they're feeling. And the goal, which I'm sure you've all been through MI, is to elicit the youth's own motivation for change. And it's empirically based, MI is, and easy to learn, and it helps move from telling to guiding in a meaningful, respectful way. So you go through screening, you see that there's elevated risks, you do some MI training and start doing that in your sessions, meeting with youth, and you're kind of realizing maybe they need some more. So then you can move on to the second line of support, which is cognitive behavioral techniques. And these are informed skill sessions. It's for youth who might need a little bit more support. And we've developed the online learning modules too, which are fantastic and really easy to digest and move through. And again, you'll get your certificate. So it's helpful if you're working with a youth that's managing stress and anxiety, trying to build healthy routines, strengthening coping skills. And again, they can be delivered anywhere. You don't have to be a licensed clinician to do them. Really helpful. And I think you will find them useful. And again, we'll connect you to all of the resources needed. So next slide, which I still don't understand why I put this slide last, but anyway, Screen for Success, which I kind of touched on a little bit, is our flagship digital screening tool, and it's ready to go. It's free, ready to implement. I kind of ran through all of this, so I'll touch on the high level points. It screens across multiple domains, which are mental health, substance use, physical health, family environment, life satisfaction, and well-being. And one of the neat things, and some of you being in Colorado, you may have gone through global appraisal of individual needs trainings many, many moons ago, because I know the state was using that statewide at one point for certain different programs. So this is based off the game, and it's a shorter, obviously, 10 to 15 minute screening tool. And it gives that personal feedback, which if you did the game, you might remember the personal feedback report. And it helps users identify where the support might be needed without judgment or labels. And again, there's two types of access points or accounts that folks can access. There's individual accounts, which is really good for parents, caregivers, concerned adults who want to check in with young people in their lives. And then organizational accounts, which might be something that would be good for your organization and clinics, youth serving agencies. It's really open to, the sky's the limit. So if you are in contact with one of your partners and think that they could benefit from this, definitely pass the information on, because the next slide is going to really show you how to register and get it. It's very easy. So I think we are ready to move to the next slide. So this is the QR code, which is golden, in my opinion, because that's going to be the gateway to get to Screen for Success and how you can sign up. Easy, takes a day or two to get your information back and get it processed, and you'll be ready to go. So one of the pieces that I talked about when I was going through the youth serving professional piece, which is similar if you're familiar to SBIRT. This is not SBIRT, but it's a very similar concept when you look at the screening. And then the brief intervention piece would be the MI, the CBT, and all of that. And then referral to other services would be if all of that was, it didn't quite meet the needs, then obviously you would refer to additional services. And one of the pieces that you can do if you do sign up for a Screen for Success account is you can customize the referrals. So you can put local referrals in, which I know are ever changing, and that can be a challenge, but it's something that is an option to account holders. And again, no cost, no charge. It's fantastic. Next slide, Chelsea. Thank you. So call to action. We've walked through the suite of free, empirically rooted and ready to deploy tools, but now comes the most important part, is how you would have this activated in your communities. And as school prevention leaders and prevention specialists, I think you're in a unique situation to turn these tools into results. And just a couple ideas how is to identify a local champion, which it could be you. But every school has that network of youth serving public health and community coalitions that you work with and work alongside with. And your role is to really empower those champions and give them tools like Talk They Hear You, Screen for Success, and Parents Night Out to deepen the impact without stretching resources, because the dollars are tight now, tighter than they've ever been. And this is something that's available to you and all of your partners for free. So the next piece is join the Talk They Hear You Partner Network, which again, in the next slide, there'll be a QR code with all of that information, and it'll connect you to other states, communities. We do quarterly-ish community engagement webinars and have free resources that we'll send out. And it's a chance to share strategies, troubleshoot challenges, and shape what comes next. So some of the things that you can get by signing up to be a Talk They Hear You partner is you'll get early access to the tools and trainings, pilot upcoming resources that we might have, and we often will seek out feedback from folks that are licensed, help us evaluate and improve feedback loops if you want. It's all obviously not mandatory, but an option. And you can integrate your tools into existing initiatives. Like Chelsea had mentioned, that all of these resources are customizable and you could add your own logos along with how it's already marketed and branded. So you don't have to, recreate the wheel. It's all here, and we are here to help walk you through it. We're just a phone call away. We often will hop on Zooms or webinars to help people, provide TA. So there's that piece, which is huge. And again, it's something that you can integrate into your existing initiatives and really help build that and move your school-based prevention curricula forward and parent engagement and all of that. And I know we're running out of time. We had 30 minutes and I just looked down. So it's nice that we are now on to the last slide, Chelsea. And if we can leave this up for a little bit so folks can scan this, but I also think these slides are going to be sent out. But again, this is how you can stay in touch, the email where you can reach us, the QR code where you can sign up for everything. If you want to follow SAMHSA on the various social media platforms, that's all right there. So thank you all for bearing with us, and we stole 11 minutes of QA, but I apologize. Time flies when you're having fun.
No, you're fine. Thank you. Thank you both for that. There is a question. So the trainings you mentioned, how long are those trainings? How long would it take someone to go through those?
Chelsea can answer that one better, and I would say it depends.
Yeah, so they range from, I would say, an hour to 3, but they're you can go, they're asynchronous, right? Like you can go through them yourself. You can spend as much time or as little time. It's really your self-learning, kind of going through at your own pace. You can come back to it if you want. But some are shorter, some are longer, some have more lessons than others. When we post them live and when we start to send them out, the time is within each of the trainings, so you'll be able to see that there.
Awesome. Thank you. Another question with that, with the trainings, are the trainings offered in other languages?
Not yet.
Okay. But you were saying there's information like available in Spanish, correct?
Yes, we do have a suite of products that are in Spanish. Yes.
Okay. And then on the podcast that you mentioned, I know it's kind of geared towards parents and caregivers, but working with high school age youth, are there some that you might recommend that for teenagers to even listen to?
Oh, teenagers, yes. I think it would depend on what their cognitive level is and if they would find it interesting, but adults, parents, caregivers, I think it will be most helpful. And I listened to every single one of them 5 times when I was coming on board to this team, and they're just so easy to listen to. They're very conversational. It feels like you're there. So just knowing that teens usually like shorter bits and pieces, I think it would just depend
And
on
we
the
do have
team.
a couple, I think at least I know we have one for sure. I can't remember, Jenny, if we did more than that, but we did
Oh,
have
yeah.
some teams on. They were our
Yes.
guests and they spoke, particularly athletes, which we thought was really cool to talk about. But yeah, our guests range all over the
Yeah.
place.
And you just kind of rung my bell that there are some quick clips on there
Yeah.
too, which might be better for teens because, you know, as a mom of a preteen, having someone sit down and listen to something longer than like 20, 30 minutes in this day and age, sometimes it gets lost, but there are quick clips, which would be great for teens. And it's all on there. If you download the series, you'll find them all.
Awesome. Thank you both so much. I dropped in the chat, we do have a quick feedback form. If for the attendees who joined us today, we will send out this recording and we will send out, if you all are okay with us sending out the slides, we can do that as well. And then I did drop in the chat our next webinar that we host since we're starting this series once a month. So to kind of kick off Red Ribbon Week, we are going to have the DEA join us. So we're hosting these on Mondays. So the next one's October 27th at noon. So the link is there, information is there. But Jenny and Chelsea, thank you so much for joining us today. We really appreciate you sharing this resource with us.
Yeah, thank you for having us. And if questions come up, you know where to find us. So
awesome. Will do. I'll stay on for just a minute in case there's anything else, but thank you all again.